right, welcome folks to episode 7 of Stepping Off with the DC Foot Doctor podcast. I'm Dr. Kevin Jefferson, podiatrist and foot surgeon in Washington, DC. I have a very good special guest with me today, Dr. Jared Casal, a rising fourth-year dermatology resident in North Carolina. We're going to be talking about a lot of dermatology, but we're going to talk about how one becomes a dermatologist, what it means to be a dermatology resident, and then we're going to talk about how he got into the whole social media game. He's very active. If you're not following him on TikTok, Instagram, YouTube, all that good stuff, I'm going to put all that information in the description of this video. Be sure you follow this guy. He's putting out good information, and I'm learning from him. He's learning from me. We connected through social media. Social media is bringing us all together in this crazy world. So it's been, I've been enjoying what he's doing, and we comment on each other's things that we put up on each other's content, and it's been just a great fruition, a great friendship we developed, and I want to put that out there to everybody in medicine and outside of medicine to see how these things work. So Jared, Dr. Casal, I appreciate you joining me this afternoon. I want you to go ahead and introduce yourself. Tell us a little about yourself and what you're doing down there in NC.
Excellent, excellent. First and foremost, I just want to say thank you, Dr. Jefferson, for having me on your podcast. It's an honor. Really appreciate it. Like you mentioned, it's been really cool to see the social media space evolve. And, we kind of became friends over social media. And I like duetting your videos and, putting out good information, just kind of recapitulating and trying to educate everyone on what's out there as far as the overlap between our fields, which is like fantastic. I grew up in North Carolina. I've lived here since I was about 5 years old. Went to undergrad here, went to medical school here, and I'm here for residency training. So kind of through and through North Carolinian. And I'm hopefully going to stay here when I'm done with training, but to be determined on that front.
All right, bet. Man, I'm very proud of what you're doing, brother. Seriously.
Thank you. I appreciate that. Thank you so much.
To see young cats jump into this area of medicine, one, because dermatology, if most folks don't understand, is very competitive to get into coming out of medical school. It's extremely competitive. It's competitive up there, say with orthopedic surgery or what have you. So, congratulations on getting there. And then getting to this point, getting ready to start your final year of residency training coming up next month. And so, the world is your oyster, man. And I'm looking forward to what you're going to do next after your final year and what you're going to continue to do during your final year, and educating us all on what's going on in the world of dermatology. So tell us how you got into dermatology, coming through med school, when your decision-making process and so forth.
I appreciate that. I appreciate that a lot. Yeah, so a lot of people go into medical school kind of knowing what they want to do. They have some sort of goal in the mind. They want to be an orthopedic surgeon. They want to be a primary care doctor. They want to work in the emergency room. I kind of went in with a blank slate. I'm really fortunate. My brother, he's older than me. He's an orthopedic surgeon. He's 6 years older than me. And so when I was kind of deciding what I wanted to do, I was like, well, that's an option. I love working with my hands. I've always had this sort of creative streak. My dad went to art school. And so I definitely inherited that from him. And so I was like, well, I really like working with my hands. Maybe being a surgeon would be kind of up my alley. So I don't know what it was, but something drew me towards ENT, ear, nose, and throat. And a lot of people don't know this, but ENT doctors, they do any surgery from the clavicles up. So if you have any sort of facial trauma or, rhinoplasties, anything on the face, ENTs do that. So the facial plastics component of ENT is kind of what drew me to it. And I did an ENT rotation while I was a third-year medical student, and I just didn't love it. It wasn't my passion. I could tell, even the bread and butter cases, the ear tubes, tonsillectomies where you take out tonsils of little kids. I wasn't feeling it. It wasn't my passion. I could just tell that right off the bat. And so I kind of had to pivot, third way through, about 3/4 of the way through third year of medical school. And I was fortunate that my mom, she was a nurse, and for most of her career, she worked for a Mohs micrographic surgeon. And for anyone listening, what a Mohs micrographic surgeon does is they take care of skin cancers on areas where you don't want to take a lot of skin. So if you have a skin cancer on the arm or the leg or the body, you take the skin cancer off, take a margin around it, but you don't want to do that in the face or the hands because there's not much skin there. So you want to only take what you can see. And so the whole idea of Mohs surgery is you take the skin cancer, analyze it on site, make sure you check the margins to make sure you got the whole skin cancer, and then you have a defect that you created to get rid of the skin cancer, you close it up. So it's got this sort of aesthetic, cosmetic component to it too. And that's kind of what drew me to dermatology. And I kind of applied really late in the game. And I was super fortunate to just wind up where I landed. I mean, I'm at my top choice program here in North Carolina. And I honestly just, I'm thankful every day because it's a blessing, it's a dream come true.
That's awesome, man. That's what I want people to understand is for dermatology what it is, and then explain what it isn't. What people really don't understand, maybe they're understanding it more with like watching Dr. Sandra Lee, Dr. on Pimple Popper, and all that kind of good stuff that we see on television, all these other things that are available out there. That dermatology really does have its surgical component, right? A lot of it may not be done in the OR, but there is a lot of hands-on. It's just not the beauty things that we see on some of these other things. So explain to the good people out there what really dermatology is.
Yeah, that's a great question. And quite frankly, even when I was in medical school, did not have a full grasp of what dermatologists did. I thought they were just skin doctors, and that's kind of where it ended. And I think social media kind of paints this picture of dermatologists being these purely cosmetic doctors. We do Botox, filler, and lasers. And I would say that is part of our training, but it's only about 5 to 10%. I think the majority of it is treating skin conditions, treating conditions in the hair and the nails, and doing a lot of surgery. I think people would be extremely surprised by the surgeries that we do under local anesthesia without ever stepping foot in an operating room. Some of them, some of the surgeries that we do include excisions of melanomas, excisions of basal and squamous cell, other types of skin cancer. And especially if you're doing that Mohs micrographic surgery I mentioned, a lot of times you have to be really kind of detailed and creative in the way you repair a lot of these lesions. So you can do, tissue grafts. You can take skin from one area of the body and graft it to the face. You can do flaps where you take a piece of skin and rotate it to kind of close up a defect. So we're doing a lot of almost borderline plastic surgery cases, all done under local anesthesia in the office with the patient completely awake. And I mean, we do a lot of surgery, and a lot of people don't realize that. They think of dermatology as it's really just a cosmetic aesthetic field.
Was that something that you realized as soon as you started your residency program, or did you like what did you just realize as the years went on, the past few years went on? Wow, this is really hands-on. I mean, we're really getting elbow deep in here.
I definitely think it's something that I came to know and love only after I was already in residency. I kind of had like a rough idea that dermatologists did a lot of surgery, but actually only until starting residency did I see the volume and the depth and kind of what they do on a day-to-day basis because I was actually doing it myself. So it's one of those things that you don't even realize. Even when I was in medical school, I had like, no clue what dermatologists did on a day-to-day basis. And some dermatologists have like full days of their week where all they're doing is excisions all day long, whether it's skin cancer or cysts or lipomas. And I mean, they're just doing surgery day in and day out.
So folks, one of the things that we do as residents, and I did my residency 25, 26 years ago, is you rotate through different medical services, orthopedics, plastic surgery, internal medicine, family practice, and so on. And it makes you a well-rounded physician. And there's a lot of overlap in some of the training. And I did my podiatric residency in Brooklyn, New York, at Brooklyn Hospital Center. But some of the rotations I did really helped form my skills and helped form my, way of thinking and providing medical care. And one of the rotations I learned the most from was not general surgery, even though I did well in all the rotations, but the one that really stuck to me even with foot surgery, was plastic surgery. My plastic surgery rotation, my plastic surgery doctor I was under during that rotation really taught me the importance of handling tissue delicately and well, and having respect for the tissue. Just don't throw everything together or willy-nilly just go through tissue with a knife. Be very respectful of it, and you'll get better outcomes. And I was able to transfer that to foot surgery. And I have very good outcomes in my foot surgery and in my workup of patients and seeing, understanding what their scar history is and all the other kind of good stuff and doing surgical planning. So for you, there's overlap in other fields of medicine. What have you seen that's been most beneficial to what you're doing as a dermatologist?
Yeah, that's a fantastic point. So, in medical school, we kind of go through these different rotations, and you even do the same as a resident. So, I spent a month a few months ago with a vascular surgeon doing leg veins. He does a lot of leg veins all day.
Mhm.
We spend some time with oculoplastic surgery, where all they do is surgery on the eye, or
Mhm.
plastic surgery, in general, where we send cases that are large melanomas to plastic surgeons, and they have to be creative in how they repair it. So yeah, that's a huge part of our training and it's super valuable. And I'm hoping this year, if I get some elective time, I can go to podiatry and spend some time with you guys because we bounce patients back and forth all the time. So I think
Mhm.
it would be awesome to see that continuity of care from the time, we refer a patient to you to them coming back and then kind of getting full circle with that, which I think would be awesome.
Excellent. What do you find, you're moving into your fourth year, your final year of training. What have you found that's been most surprising in dermatology that you did not expect?
That's a great question. I think I would say patients always take you by surprise. What's concerning to one patient can be meaningless to another, and that's one thing I've come to realize. Some patients will come in and they're not at all concerned with aesthetic outcomes. They're there for a skin check, and we find some skin cancer on them. They're like, "Oh, just do what you got to do, remove the skin cancer, and sew me up, and call it a day." Other patients come in and they have a freckle and they're so concerned that the freckle, like, oh, the freckle's benign, it's nothing to worry about. But they're like, no, but I want it gone. It's really bugging me. So, but the variation in patients and how they perceive their own skin and what certain patients are comfortable with and what certain patients aren't. And honestly, just having the ability to connect with those patients in such a variety of different ways and all these different skin conditions, I think it's one of my favorite aspects of the job.
Fantastic. Well, there's another thing people need to understand what dermatology is not. It's not all Hollywood. You're not going to have all these celebrities coming in to get their face ready for the camera and all that kind of stuff. It's mostly everyday folks with everyday issues. And some of the issues are very extensive, very problematic. And they're associated with other diseases. Diabetes comes to mind. There's a lot of skin issues with diabetes. Even some GI issues have skin issues. Like you mentioned earlier, there's a lot of cross going back and forth between what I do as a podiatrist and what you do as a dermatologist. I've sent people to dermatologists and they send patients back to me all the time. A lot of what we do in podiatry is skin related. Now, the difference in other areas of the body as far as podiatry is concerned, we also have to be very cognizant of biomechanics, how walking and wearing shoes and activity level and sports and everything plays into the skin issues that we see in of the feet. At least twice a year, I biopsy a melanoma on the sole of the foot. All right, skin cancer is not just from the waist up. It can happen anywhere from top of the head to the tip of the toe. Matter of fact, the first melanoma I ever biopsied was I was a third year student in New York, and I biopsied a melanoma on the tip of a lady's toe, a black woman. Now, one of the things I also want you to talk about is how there's this popular misconception that people of color can't get skin cancer. Talk about these other different things and then that in particular, if you don't mind.
100%. Yeah. So I think that is something that sometimes patients get taken aback by. When we're doing a skin check, we
Mm-hmm.
always check the bottom of the feet and in between the toes. And
Mm-hmm.
people are like, I don't think I've ever had anyone look between my toes before. And they're like, do you actually, a lot of the patients ask, like, do you actually see skin cancers there? And the answer is yes. I mean, yeah, like to your point, exactly. And in darker skinned patients, melanomas definitely have a predilection towards the hands and feet. And we just know that to be true. I mean, that's what killed Bob Marley ultimately
Right.
was this type of melanoma that we see on the hands and feet. We call it an acral lentiginous melanoma. It's a very aggressive type of melanoma. When people get it, you have to treat it extremely aggressively. And unlike other types of melanoma, it's not as associated with sun exposure, but sun exposure always plays a component. And I mean, your skin is your biggest barrier defense against the sun. So anytime the sun is hitting any area of the body, there's predilection to causing DNA mutations that lead to skin cancer. But yeah, all that to say that we do see. I mean that does come up in our practice. Darker skinned individuals do get melanoma. They also get squamous cell carcinoma. So we see that as well.
Yeah, you mentioned Bob Marley. Right now, I'm treating a patient who I biopsied about 6, 7 months ago now, she had an ALM, an acral lentiginous melanoma, and she's Jamaican, right?
Really?
She's Jamaican, and so she's very aware of the Bob Marley history and how he had an ALM in his big toe, and eventually, you know, he passed because of it, right?
Right.
So when she had this growth in the middle of her foot, I biopsied it, came back ALM, sent her directly to oncology. They sent her to the oncology surgeon. They took out a wide excision. It was a big lesion. The lesion was probably about 3 centimeters across. It was huge for the bottom of the foot. So they did a wide excision, did a flat closure from her thigh, and about 2 months ago the flat failed. So now I'm treating her as a wound care patient. Right, she's still my patient, but the cancer part is over. But now she's a wound care patient. I got her on negative pressure and all that kind of good stuff. So these are difficult cases, and you have to work in concert with your colleagues in other fields of medicine. I mean, we have to come together to get these things to resolution, man. So I'm glad you mentioned, wanting to see what we do, what makes us tick. I hope you get that opportunity, even if it's for a few days, to see what's going on. And if you get to go to diabetes clinic, brother, make sure that happens. You're going to see some stuff that blows your mind. We're seeing, dermatologists go into wound care now. Wound care is an ever expanding field. All right, so you're seeing vascular surgeons get into it. General surgeons they're no longer doing general surgery. They're doing like 100% wounds now, some of them. So there's a lot of change, a lot of cross training. We work together to get these difficult cases resolved, and I'm glad you realize that, man. So you're in your last year is starting up in a month or so. I hope you are you in some downtime right now, or are you guys still working?
I'm in my last rotation of this year, and
Okay.
it just happens to be that I'm on pathology. So we do a lot
Okay.
of pathology, looking at stuff under the microscope. So this whole month, that's all I'm doing is just reading slides and working with our dermatopathologist to look at stuff under the microscope.
Gotcha. Now, residency is difficult. It's difficult physically, time wise. It can be difficult emotionally, spiritually. We know there's a lot of doctors that aren't doing well. Young lady in New York took her life last week. She was orthopedic resident, wasn't she? I believe. I think she was an orthopedic
I believe
resident.
so.
Yeah, which is a difficult area to get into, especially for a black woman. And she committed suicide. So one of the things that we talk about with residents is, what do you do to deal with the stresses, not just the stresses of the job, but the stresses of getting yourself ready for the future, the stresses of the work. Not all cases go the way you want. Some cases, I remember one of the things a doctor told us early on when we first started, you're not going to be able to help everyone. There's some cases that are going to go south. That's just the way medicine is. But you have to be able to build up your energy and your spirit and everything to be able to keep working, to keep pressing. And I see that with you in your role in social media now, how you get to really spread out what's happening. Tell me what you do to keep yourself even keel, and how social media has played into that.
Yeah, that's a great question. I think for me, I think as a generalized answer to the question, it's gotta be just something that's gives you satisfaction or makes you whole outside of your career, your job. I think that kind of separating yourself from what you do on a day-to-day basis, especially when you're dealing with a lot of morbidity and mortality and things that really cause people a lot of distress in their day-to-day life, is really important. So for me, I mean, that looks just kind of like just unplugging. I like going to the gym, um, going for rides on my bike. I'm fortunate to live near the beach. I can go walk on the beach, which is really nice. Reading some books. Social media is great. It's a nice little release. It's a little bit kind of stepping out of your own reality into this virtual world for a few minutes. And I don't think it's necessarily the best thing to consume day in and day out, but for a few minutes here and there, I don't see that it's that big of a problem. And then just, I mean, for me, a lot of spiritual stuff too. I just try to ask God to keep me grounded because life is crazy and getting thrown stuff every day. And for me, that's just a big part of it is trying to stay grounded in the midst of all the chaos around me. And so I could definitely do a better job of that, no doubt. But trying my best out here.
Yeah, appreciate that, man. Look, you're becoming a social media giant. I don't know if you realize that or not, but with what you're doing and in educating people with what's going on in dermatology, what people need to understand about themselves and skincare and products to look into, products to avoid, misconceptions about certain products and things like that. How did you develop your way of doing social media? How did you develop your protocol, if you will?
Yeah, absolutely. And I actually wanted to ask you the same thing.
Yeah.
How about your Genesis story? But
Mhm.
I'd be amiss if I didn't give a shout out to one of my best friends and one of my mentors in life. His name's
Mhm.
Dr. Manib Shah. A lot of you guys have probably seen him on social media. He's at Derm Doctor on TikTok and
Mhm.
Doctorly on Instagram. But he's one of my best friends. He's the motivation for why I was ever on social media in the first place. And he basically said, there's a lot of bad information out there. We need more experts. We need more doctors on here giving out good information to people that they can really trust and listen to. And he's actually the whole reason I'm on social media. And he's also really guided my path on social media too. Ever since you kind of get into the space, it's tough to navigate because for the first time in your life, you're putting something out there that's going to live on in perpetuity. You have videos of yourself. You want to make sure you're saying the right thing, putting good information out there, and not harming anyone is the biggest thing. Hippocratic oath, first do no harm. So I don't want to put something out there that someone's going to misconstrue or take the wrong way and then might harm them. So Dr. Shaw really, really guided me in that respect, and I'm super grateful for him for that. So give a shout out to him. But how about you? What's your Genesis story for social media?
Well, for me, I was already well into my practice. I guess over maybe 15, 16, 17 years, I was already into practice. Now, I was still in podiatry school when the internet was born, right? So you're a digital native, right?
Right.
So I had to learn this stuff on the kind of on the back end. I came in the early days. I'm pre cell phone. I'm all that. I'm just one of those older dudes. I'm not an old dude. I'm one of those older dudes. But I've always been a techie at heart. So I learned this stuff quickly. And so I guess about 15 plus years into my practice, I started integrating technology into the office. I was doing EMR long before EMR became necessary, or they made us do EMR. I opened EMR. I welcome EMR with open arms. A lot of doctors didn't get it. A lot of doctors retired because they had to go into the new era. But I always welcome this type of stuff. And so, I was looking for different ways basically to market the practice. And so YouTube was my first foray. And I was doing little simple, very terrible videos, very technically terrible videos. And, it wasn't getting much traction. But my wife of now 21 years, you know, kept encouraging me. And I got better equipment. I got better at creating and things of that nature. All right, so it just kept on growing and growing and growing. It started out as like I said before, just for marketing purposes, get the name out there, but it just grew and it took care of itself, man. That's what I want you to understand, and everybody that's out there doing this good work. If you do good work, it takes care of itself, right? So now I have over 400,000 subs just on YouTube, right? Well over
That's
80,000,
incredible.
well over 80,000 on TikTok, maybe 5,000 or so on Instagram, and I don't know how many thousand on Facebook. But I'm not saying that to toot my own horn. I'm saying that to let people know that if you continue, when you're first starting, nobody knows who you are. You're lucky to get 5, 10 views. Maybe you'll get 20 likes or whatever. Don't get discouraged. Keep on producing and keep putting up good content, good material that people can learn from, and then it will take care of itself. Dr. Casal, I get more referrals from social media and YouTube than I do through my website and the insurance books and doctor referrals.
That's amazing.
That's just the way it is. It builds upon itself. Okay? So don't, I always tell you, like guys like you and everybody else that's looking to get into this, keep on going. Don't stop. It will take care of itself. Hey, Dr. Jefferson, I saw you on YouTube. I had to make an appointment. I saw you on IG, or I saw you on TikTok. All right? TikTok is my number 2 referral source. But that wasn't the goal. That was just to try to stay current with what the kids are doing. You know, I didn't want to be that old dude trying to catch up on the back end. I want to stay current with what the kids are doing, and it's been a blessing to me, man. It's been a blessing to the practice, to the family, and to the community, because I'm able to have more people come in, because that's the way people communicate now. All right, we have to see it as fun. It's all cool, but it's also a tool, and a tool is only helpful if you use it correctly. So, man, look,
Absolutely.
I appreciate you jumping on in here, man. This was fantastic. I love what
Definitely.
you're doing. Keep it up, brother. Good luck on your final year. Do you have what are you thinking for when you're done come July 25?
So right now I'm in the process. I'm going to apply probably to Mohs surgery fellowship. So it's
Okay.
it's an additional year of training after residency. So I'm going to be applying to that, and Lord willing, I'll get it. And if I don't, then I'll still practice and do some general dermatology. So either way, I feel like I'm on a good path, and I'm happy to be where I'm at. And thank you so much for having me on here. One thing I want to just give you a little shout out is your production quality is second to none. I
Thank
think
you,
I
sir.
found you on my For You page, and you're putting out awesome information. You're articulate, you're smart, and you get people the information they need to help treat their own condition. So I really appreciate you, and thank you so much for having me on. I really appreciate that.
I appreciate that, man. And I'm already calling you a colleague. Yeah, you got another year of training. You got another year of Jedi training, but you're already a colleague, brother. I look forward to what you're going to do for the medical profession, what you're going to do in your community, wherever that is, whether you're still there in NC or wherever the winds take you, man. I know you're going to do well. Keep on killing it on social media. I'm looking forward to your YouTube channel down the line as this thing grows, man. As this thing is going to continue to grow for you. So, folks, again, thanks to Dr. Jared Casal for joining us, talking about dermatology, talking about whole kind of good stuff. So you have to follow him, whether you're having issues with your skin or any of your loved ones or what have you. Skin is just not cosmetics. Skin is the first line of defense, and the skin is under constant attack. All right, we know so in podiatry, but all over the skin is under constant attack, 24 hours a day, 365. And I'm glad we have young cats like Dr. Casal coming up the ranks and dealing with these issues. I look forward to meeting you in person one day, brother, so we can, definitely meet, talk about this thing, and just kick back and have a good time. Check out his information in the description of this video. And like I always say, take care of your feet.